भरपूर काम होतं. दुसरं कोण चालेल नाही. दुसरं कोण चालेल नाही. दुसरं नाही. ठीक आहे, बघतो ते प्रॉब्लेम लिहून ठेवतो. वाटलंच तर मी तर वाटलं मला करतो. काय करू शकत नाही. तरी बोलवा मॅडम, आपलं फक्त तिकडे बसतो. सर सुरू करा सर.
ओके सर. Good morning, everyone present. Myself, Dr. Swanand Shukla from Motiwala Homeopathic Medical College. I'm professor of community medicine. Today we are dealing with a topic that is nutrition and health. A very important topic from practice point of view and applicability point of view. So we are having, when we are talking about this nutrition and health, what do you mean by nutrition? First question comes, and the nutrition means it is a science of food and it is applicability in day-to-day life. So we are learning nutrients over here. And when we are learning nutrients, what do you mean by nutrients? These are the dietary factors which are present in our nutrition. So nutrition, why such an important topic and vital topic? The reason is very important. Here you'll find this is connected with the various aspects. First thing, it is internationally nowadays it is recognized, and in WHO that our very important primary healthcare elements, Almaty Declaration, it is one of the important element it is considered, and UNICEF is also giving a very important value. Nutrition is associated with infections, immunity, fertility. Nutrition is also connected with the role of various dietary factors. So when we are talking about nutrition, hello. When we are talking about nutrition, so various aspects are there. Since from the beginning, if you'll study nutrition, the ancient man, the man from the Stone era, was searching for food and was struggling for food, and then they were eating raw food. And now if you'll see what kind of food we are eating, it is very much refined. We are knowing various kinds of techniques, that is roasting, and nowadays we are using microwaves and so many things we are using. So very important aspect, nutrition has changed its role. We started the journey from proteins and the amino acids and the micronutrients, vitamins and minerals. And now from the small laboratory, this nutrition has moved to the bigger laboratory, that is epidemiological studies we are carrying out. We are carrying out study among the population, like what we call it as nutritional surveillance, nutritional assessment, nutritional rehabilitation, and so on. So nowadays, the terminology what is used is called as nutritional epidemiology. So the nutrition, the science always grows with the time, and this is true for this science also. So we are having macronutrients and micronutrients classification, what we can go with. So macro means when we require this food in a bulk, then we are going to call it as a macronutrient. And when we are going to utilize it in a trace amount, naturally we are going to call it as micronutrients. So macronutrients are fats, carbohydrates, and proteins. And then we are having very important aspect. Another aspect is micronutrients, what we can talk about, that is vitamins and minerals. So the same thing, it is there on the slide. So carbohydrates, fats, and proteins, they form a main bulk of our food, and micronutrients as they are required in a small quantity. But yes, definitely it has a specific and very special role in the human body. So the nutrients, food factor we said, the dietetics were very important. Whatever the knowledge we will gain in these classes, when we will apply it for our patients, that science is called as dietetics. So it is very essential in our practices. So the nutrition and health changing concept, as I said, we recognize proteins, fats, and carbohydrates, and then the vitamins we recognized, and then we discovered the essential amino acids 1950, And then we said it is a the nutrition has its roots in physiology and biochemistry, and it plays a role in the nutritional diseases. We recognize all these, identified these nutritional diseases, especially protein energy malnutrition, endemic goiter, nutritional anemia, blindness. So we can connect those diseases with a nutrition. So nutritional deficiencies were identified. And not only that, a revolution has taken place, green revolution and white revolution in the field of nutrition. So international activities, what we have already talked about. We learned about the dietary factors, and the science has moved from laboratory to epidemiology. The nutritional epidemiology, a very new aspect, as I said, nutritional assessment, dietary survey, nutritional surveillance, growth monitoring, nutritional rehabilitation. These are the new terminologies and which are very much is in use in the field. So this is how the nutrition has grown its sense. And mind you, it is also connected with health for all, and it is also connected with our national dietary goals. So when we are talking about nutrition and health, the nutrients we can classify by their chemical composition, that is macronutrient and micronutrient, carbohydrate, fats, proteins, vitamins, and minerals. And then by predominating functions, exactly nutrition plays a role: energy giving, bodybuilding, protective. Then comes chemical properties, organic, inorganic. By mass, how much amount and the quantity, that defines macronutrient and micronutrient. And then comes the origin, animal origin and plant origin. So as per the nutritive value also, we are having 12 classes: cereals and millets, cereals that oblong grains, and millets that are the round grains. And then comes legumes, pulses. Okay. Then comes vegetable or green vegetables, fruits, meats, fish, that is animal food, then fats and oils, nuts and oil seeds, sugar and jaggery, condiments, spices, and others. So this is a classification as per the nutritive value. So we can learn the profile of what exactly they contain, how much amount of protein, fats, carbohydrates, vitamins, and minerals. So nutrients, when we are talking about, uh, here we are going to focus our attention on micronutrients. The first one is vitamins. Now vitamins are called as essential nutrients. Now why they are known as essential nutrient, that is very important to know. Essential means which is not synthesized in the human body, so that is why it is called as essential. One has to depend upon external dietary source, and that is why we are going to call it as essential nutrient. Vitamins do not yield energy. Yes, definitely they yield energy, but in a very small amount. But what is a very important role, they plays a specific function in our body, and definitely when they are deficient, they lead to the disease conditions. So the classification, I think we have learned at several places: fat soluble, then the water soluble, vitamin A, retinol, vitamin D, calciferol, vitamin A, tocopherol, and vitamin K. And then B1, that is thiamine, B2 is the riboflavin, B3 is niacin, B5 is pantothenic acid, and B6 is pyridoxine, B7 is biton, about beton. Then comes B9, folic acid, and then the B12, that is cyanocobalamin. And very important, last water-soluble vitamin is vitamin C, that is ascorbic acid. So they are very much required in the human body. They are required in small traces, and they are essential. One has to depend upon dietary sources. So now we are coming with the first vitamin, micronutrient, vitamin A. Very much everyone knows about this. What is the exact perspective of community medicine? We have to learn these deficiency states in a community, in a villages. And when you're visiting schools or when you're visiting villages and the children, we have to identify this kind of condition. So you'll find this, it is in two forms, that is a beta carotene, and that is called as provitamin, and retinol. Its function is very specific. Very important function is for normal vision. It contributes for the production of the retinal pigments, and especially very much useful for the vision in the dim light. It is necessary for the integrity of and the normal functioning of the cells and the cell membranes. It supports growth especially skeletal growth, and it is considered, it has a very specific role as an anti-infective. So in many of the times people prescribe vitamin A supplementation to reduce infection condition or prevention, for preventive purpose. It may protect against some epithelial cancer. May, they're using a word because there is no direct evidence as such that it really uh, controls this condition or protect this condition, but somehow it has associated, and that is why they are saying may protect the epithelial cancer. Sources very important: three sources: animal food, plant food, and fortified food. Animal, the liver, eggs, butter, cheese, whole milk, fish, and meat. So all fat giving diet. The milk contain that cream which floats when we are eating it. So that is a fat, and naturally it provides a good amount of vitamin A. Plant food, leafy vegetables, spinach, amaranth, and all these kind of green leafy vegetables provides this vitamin A in the form of carotene. The darker the leaves, the green, more the green leaves, higher carotene content. And then very important thing is yellow fruits. Any yellow fruits means yellow color dietary, any what we can say food item can provide vitamin A. So fruits, they are saying papaya, mango, pumpkin, even we can include bananas in this. And very important, the root, one of the root, carrots, that contains carotene, and that is why the name is carrot. And then comes fortified food. What do you understand by fortified food? When we are adding essential nutrients to our day-to-day use dietary item, that is called as fortified food. So we, in atta, in a flour, we are adding vitamin A and vitamin D. Or you'll find vanaspati ghee. Nowadays it is not in much use, but yes, if you see the container, it is always mentioned, it has been mentioned that it is fortified with the vitamin A and vitamin D. So this is a structure. We said plant, animal, and fortified food. Now deficiency states is, first one is what is called as night blindness. So you'll find this is the first picture. Usually mother comes to clinic and talks about that this boy search food in a dish in the evening time, doesn't get, or he bangs while walking here and there. And that is how mother or the family members recognize that night blindness is there. Then the next natural history of disease in this condition is conjunctival gerosis. Conjunctival gerosis in the sense conjunctiva, when you'll see, it is very shiny, very bright, and you'll find it is normally like that. But when there is a deficiency state, you'll find this conjunctiva becomes like chalk. So it is not wettable, dry, and you'll find it is like emerging sand from the receding tide, or recently cried child look is there with the conjunctival gerosis. Means dryness. Osis, gerosis is a dry condition of the conjunctiva. Then comes bitot spots or bitot spots. So these are the red triangular patches, pearly patches, bilaterally present foamy spots on bulbar conjunctiva. So usually this kind of presentations we had seen at ashram shalas and other various places. So by bitot spots. Then comes corneal xerosis. Corneal xerosis in the sense, now the cornea is becoming dry. It is dull, dry, and non-wettable. And eventually you will find the cornea becomes dry. It is the most projecting part of the eyeball. And mind you, the friction leads to ulcerations. And the very grave condition, that is keratomalacia. Kerato related with the eyes, and malacia is a what we can say softening. So there is a liquefaction of cornea taking place, and you'll find this is a grave medical conditions where a person may lose his eyesight. Extra ocular manifestations are also there: follicular hyperkeratosis, anorexia, growth retardation, respiratory and intestinal infections. So these are some pictures which depicts the xerophthalmia and keratomalacia condition. Now we are coming to the vitamin D. Now, when we are saying vitamin D is very unique, it is derived from sunlight, but of course this statement is also not right, because we are using that ultraviolet rays are playing a role in conversion of this sunlight. The sunlight, ultraviolet rays present in the sunlight, it helps in conversion of precursor of vitamin D to vitamin D. So when we are saying Uh, Vitamin D function, very important function it has. So in intestine, absorption of calcium and phosphorus, then it stimulates the normal mineralization of the bones and reabsorption of the again calcium and all those things, minerals. Okay, then kidney, it has also action on kidney. It increases the tubular reabsorption of phosphate and variable effect on calcium. So it also helps in a normal growth. So vitamin D is it is synthesized in the human body. So ideally speaking, when we are saying vitamin E is a essential nutrient, yes, it is not fitting in that definition. So some people may call it as a hormone, one of the hormone. So before going to that, what is the sources of this? So naturally, we said vitamin D is we are getting it from the sunlight, and the ultraviolet rays helps to develop this vitamin D. Other sources are also there, but of course they are in a small amount. Fish liver oil, liver, eggs, and human milk also contain good amount of this vitamin D. So the infants, the nursing children are getting this vitamin D source. And fortified food, what we said in vitamin A, same thing is there. Now we are coming to very important deficiency states. Two deficiency states are very commonly seen. So rickets you'll find in the children, and osteomalacia in elderly females, especially the females who are in a reproductive age group and pregnant and lactating. Yes, they are prone to develop this kind of condition. So vitamin D deficiency in children, it leads to a condition what is called as rickets, and it is characterized by growth failure, bone deformities, muscular hypotonia, tetany, convulsion, and hypocalcemia. And bony deformities are very common, like curved legs, deformed pelvis, pigeon chest, Harrison sulcus, rickettsial rosary, kyphoscoliosis. So you'll find various bone problems. In Marathi we call it as murdus. So you'll find this condition where the child bowing of the big bones, like femur, and they are becoming curved. Or kyphoscoliosis is something suffering of a spine, where you'll find the curvatures get abnormal. You'll find rickety rosary, the ribs are standing out. So this is what exactly a rickets is. And then coming to osteomalacia. So here when we are talking about osteomalacia, so it is again seen, malacia means softening. So as there is a poor mineralization, this takes place in pregnant and lactating females. So some pictures of this rickets. Now we are coming to another fat soluble vitamin, vitamin E. So up till now we have finished with vitamin A, D, E. Now we are starting with E. So fat soluble vitamins are four: A, D, E, K. So A we have done, D we have done. Now we are coming with E. So it is widely distributed in our food. So vegetable oil, cottonseed oil, other things provides this a good amount of this vitamin E, tocopherol, and food-rich polyunsaturated fatty acid, PUFA, what we call it as, that is also rich in vitamin E. Now the functions are very important. The functions, you'll find it plays a role in the, sorry, molecular level. And mind you, exact role is still we are exploring it has in human body, we are not sure about it. But deficiency, what it leads to, the cytotoxic effect of vitamin E is also seen on human lymphocytes. So be cautious when we are taking this. Nowadays people are thinking that vitamin E is for good for skin and other aspects. So whenever you are taking any supplementation, you have to find out a rational, a reason why I'm taking this tablet or why I'm prescribing this tablet. So we are not yet proved some anti-sterility effects when this is deficient in lower animal has been noticed. But of course, there is no much strong evidence as such. So we will go now right to vitamin K. So the sources, when we are saying green, dark green leafy vegetables, fruits, and cows milk, they are the sources. And deficiency is not so common, but mind you, the function is very important. It helps in synthesis of coagulation factors. So deficiency of vitamin K, it leads to it affects the prothrombin content of the blood and decreases and blood clotting time. Normal requirement of vitamin K of a man is made by combination of dietary intake and microbial synthesis in the gut. The daily requirement for man appears to about 0.03 mg per kg of adult. So vitamin K, all these vitamins are required in a very small amount in the body, but plays a vital role in the human body. Now we have done with ADEK, that is fat soluble vitamins. We are coming with water soluble vitamin, and the first one is thiamine. So when we are saying thiamine, here the important sources, whole grain cereals, that is wheat, rice, pulses, oil seeds, nuts, especially ground nuts, meat, fish, eggs, vegetables, fruits, contains means animal food contains a little less amount of this thiamine, that is B1 we are talking about. Milk is an important source for thiamine, for especially for infants. Now when we are talking about the deficiency conditions, the two important deficiency conditions are there: beriberi and vernix encephalopathy. Okay, so the functions we have mentioned over here, and deficiency, as I said, there is a beriberi and vernix encephalopathy. So I think this slide is not readable, but I will talk about. So when we are discussing about this beriberi, there are three types, that is dry beriberi, wet beriberi, and infantile beriberi. Dry beriberi is associated, characterized by what is called as nerves are getting involved and peripheral neuropathy or neuritis is there. Wet beriberi, where the heart involvement is there, and the vernix encephalopathy, it's seen in the alcoholics, and it is characterized by ophthalmic conditions, ataxia, mental deteriorations, like conditions. Now we are coming with vitamin B2, that is riboflavin. So it is a richest natural source: milk, egg, liver, kidney, green leafy vegetables, meat, fish. All these are the sources. Deficiency lead to what is called as stomatitis. The practitioners are giving multivitamin tablets, B complex vitamin tablets, because of for the stomatitis. Yes, definitely it has a role. Riboflavin, stomatitis. Hello, stomatitis. And then comes what is called a cheliosis, glossitis, and nasolabial dysbacchia. These are the conditions. Now, it has a fundamental role, riboflavin, in the mucocutaneous. It maintains the mucocutaneous structure. It is a cofactor in number of enzymes, and it has an antioxidant activity, and a cofactor for what is called as glutathione reductase. So these are the functions of riboflavin in short. Deficiency, as I said, angular stomatitis, cheliosis, glossitis, dysbacchia, and the whole thing we can call it as what is known as riboflavonosis. So this is also connected with wound healing, neuromotor functions. So you'll find this deficiency is there. So naturally all these functions get hampered. So neuro functions, wound healing, and susceptibility to develop a cataract, that is also mentioned. Riboflavin deficiency is always associated with deficiency of complex vitamins. So you'll find a single vitamin deficiency is not seen like that. Okay, so many of the times it comes together. So this is a clinical condition, a picture. Now we are coming to the B3, that is nicotinic acid or nicotinamide. So very important. Niacin, what we call it as. So very important sources: liver, kidney, meat, poultry, fish, and legumes. But milk contains a less amount of niacin. So deficiency of niacin leads to condition what is called as pellagra, which is characterized by 3Ds. So niacin, when we are talking about, it plays a role in the metabolism of carbohydrate, fat, and proteins, and very essential for the skin and mucocutaneous structures, nervous system. So deficiency lead to what is called as pellagra, 3Ds, diarrhea, what I have mentioned, red color, diarrhea, dermatitis, dementia. And plus to that, you'll find glossitis, stomatitis are very important. How to identify dermatitis caused due to niacin, because your Kwashiorkor condition also contains similar kind of dermatitis. Then you'll find uh, protein energy malnutrition is also having some kind of dermatitis. So it is very difficult to segregate dermatitis because usually all these conditions are coming together. So it is bilaterally symmetrical, and especially the exposed part, which is exposed to the sunlight. So hands, lower legs, and necks, these are the parts where you'll find this condition is very commonly seen. And not only that, you'll find the mental changes are taking place. Niacin, that is depression, irritability, and delirium is also seen with this pellagra. So before going to this another one, here I want to talk about niacin. The tryptophan is a precursor, but there is an excess presence of leucine in certain dietary constituents, and it hampers the conversion of tryptophan to niacin. As it happens in the maize or jowar, you will find the conversion becomes difficult from tryptophan to niacin. So the maize eaters and jowar eaters, they develop this pellagra. That is why this food stuff is known as pellagrogenic by nature. So B5 we are coming with pantothenic acid. So sources, uh, it comes from various sources, vegetables and other aspects. But what is the role? So you'll find it helps in absorption. It get absorbed in the human body. Okay, it helps in production of some coenzymes. Okay, daily requirement is 10 mg, right? Much deficiency state and sources are not very much known. Okay, but pantothenic acid indicates a role in biosynthesis of corticosteroids, means adrenal function is controlled by this pantothenic acid. B6, paradoxine. It is in three forms: pyridoxine, pyridoxal, and pyridoxamine. So it plays an important role in a metabolism, that is amino acids, fats, and carbohydrates. Sources: milk, liver, meat, egg yolk, fish, whole grains, cereals, legumes, and vegetables. So deficiency lead to very important term is there, peripheral neuritis. So whenever people are coming with a pain in a vague pain in the legs and hands, yes, definitely some multivitamin injections are given. And or you can recommend, before going to those things, you can recommend diet, you can correct the dietary source, and you can improve this kind of conditions. So as I said, peripheral neuritis, riboflavin deficiency impairs the optimal utilization of pyridoxine. There is one anti-tuberculosis drug is there. It is known as antagonist to this pyridoxine. So absorption get hampered, and that is why you'll find usually this deficiency is seen in the people who are suffering with tuberculosis and taking anti-tuberculosis treatment, especially with INH. So this is all about. Then coming to B7, that is biotin. So used in fatty acid synthesis, and the sources you'll find, that is peanut, Swiss chard, raw egg yolk, and the liver and leafy vegetables. So the deficiency leads to inborn genetic errors are connected with this, and this kind of deficiency is rare. So I think one or two vitamins we have not gone in a depth because its knowledge is yet to be explored, and the people must be working for this. Now we are coming to the very important one, that is vitamin B9, folic acid, or the terminology folic acid, it comes from folate, and folate means leaves. And mind you, leaves provides a good amount of folic acid, and that is why the terminology is there, folic acid or folate. So green leafy vegetables are the best source of folic acid. Foods such as liver, meat, dairy products, eggs, milk, and cereals, they also provide good amount of folic acids. Now the deficiency, when we are discussing about, it leads to megaloblastic anemia. So folic acid deficiency, depletion is seen in pregnancy because the energy requirement, vitamins requirement increases during pregnancy, and usually it is not fulfilled in an appropriate amount, And that is why you'll find the pregnant ladies are more vulnerable to develop this folic acid deficiency. So you can improve the folic acid diet, means especially the green leafy vegetables in a pregnant females. So megaloblastic anemia, glossitis, ileosis, gastrointestinal disturbances like diarrhea, distension of abdomen, and flatulence, they are connected with folic acid, and there is a role for means folic acid. If there is a deficiency, it may cause infertility and sterility. So a diet is such an important thing. It is connected with so many things what we can learn from. Okay, infections, eyes, infertility, and so on. So synthesis of nucleic acid is one of the very important function of this. Deficiency, as I said, in lactating and pregnant women, it produces anemia, megaloblastic anemia, glossitis, ileosis, diarrhea, distension, and flatulence. Now we are coming to the B12 vitamin that is called as cyanocobalamin. So you'll find a good source is liver, kidney, meat, fish, egg, milk, and vegetables. Yes, vegetable sources doesn't provide a good amount of B12, mind you. So usual Viva question comes for every student that if a vegetarian person comes to you and is having depletion of B12, what kind of suggestions, what kind of diet you will suggest? So simple answer is there. They are taking milk and milk products, cheese and paneer and butter and so on, right? So you can suggest them to take and consume more amount of this, and they will get their good dietary B12. So deficiency state leads to a very important neurological lesions, demyelinating, and it is also related with infertility conditions. So B12, megaloblastic anemia or pernicious anemia, demyelinating neurologic lesions, spinal cord, means the spinal cord affection is there. Infertility, it has been noticed in animal species, and people must be working on how it is, means whether it is there in human beings or not. So subclinical conditions are very common. B12 nowadays people are giving in a parental route, that is injectable forms. But what I feel, we should promote our dietary sources. These are the natural sources, and people should learn. And you, when you will be sitting in a clinic, please give this knowledge to your patients. Now, vitamin C, that is the ascorbic acid, what we are going with. And when we are saying ascorbic acid, that is vitamin C. So it plays a vital role in various aspects. So sources, when we are talking about, so all citrus lime leaf fruits. Okay. So citrus lime leaf fruits means what? Lemon, sweet lemon, oranges, they provide a good amount of vitamin C. Then vitamin C is also found in the germinating pulses, ankurit. When they are getting germinated, their vitamin C content increases. And then very important source is amla. Nowadays, COVID-19 is there and people are promoting vitamin C. So natural sources one has to learn. So when we are saying amla, that is the Indian gooseberry, is the richest source of vitamin C. So GABAs are another source, and deficiency of this vitamin C lead to scurvy. Now, when we are saying what is the role of vitamin C? So it helps in formation of collagen of blood vessels and bones and other tissues. But mind you, collagen forms a firm structure. If this vitamin C is deficient, it lead to loose collagen formation. And that is why you'll find the hemorrhages, local hemorrhages, are very common with vitamin C deficiency. So some people claims, as I said, common cold and protection of against vitamins. Here they are not, the even text doesn't recommend, but claims they are saying. So we have to find out the evidences between this vitamin C and the cold, common cold and other infections. Deficiency, the signs, scurvy, what we said. So swollen and bleeding gums, subcutaneous bruising, bleeding into skin and joint, delayed wound healing, anemia, weakness. These are the symptoms of the scurvy. Mind you, James Lind was the first person to learn about vitamin C. He was a naval surgeon. He divided his crew member into two groups. And one group, he had offered a lime leaf fruits and the other vegetables and other things. But mind you, he found that people who are on lively fruits doesn't develop scurvy. So first epidemiological nutritional study was conducted by James Lind. Now we are coming, the conditions they have mentioned over here. We are coming with other micronutrients. So we have finished with what is called as micronutrient vitamins we have done. Fat soluble, water soluble. Fat soluble ADEK, and water soluble all B group and C. Now we are coming with the minerals. So minerals are also a part and constituent of every body cell. So mind you, it is essential for body functions and it can be synthesized in the human body. So more than 50 such chemical elements we are knowing, and it helps in growth, repair, regulation of vital functions in the body. So very important role of minerals. So when we are talking about minerals, we can classify into three groups: major minerals, trace element, and trace contaminants with no known function. So major minerals, when we are saying the calcium, phosphorus, potassium, magnesium, these are the example of major minerals. And trace elements, when we are talking about iron, iodine, zinc, copper, cobalt, and chromium. Of course, the list is big: manganese and selenium and nickel and silicon. These are the other things. Now we are coming to the third thing, that is a trace contaminants with no known functions. This include lead, mercury, barium, boron, and aluminum. So we classified minerals. We are knowing more than 50 chemical substances can be called as minerals, elements. They are present in human body. They play a vital role in human body. Now, now what we are saying here is about the what we are talking about is a trace element and trace concomitant. Trace element means required in a very small amount, and the third category they are saying they are present in the human body, but yet their role, their function is not explored. So first one is calcium. So when we are saying calcium, it is one of the important elements. So it constitutes 1.5 to 2% of the body weight of the adult human body. The requirement is 600 mg per of calcium. The best sources from where we get this calcium, no doubt everyone very must be knowing, that is milk. It is in the form of what we call as calcium casinogenate. So this is a compound with one protein. So, and all milk products like cheese, skimmed milk, buttermilk, and other things, eggs and fish. Then the cheapest dietary sources what we are having is the green leafy vegetables also provide good amount of calcium. Cereals and millets like rice, wheat, jawar, bajra, they also provide good amount of calcium. And very important one, the millet which we I should mention over here is ragi. Ragi means nagli, nachni, what we call it as. Especially in a very tribal areas in various parts of Maharashtra, people are eating this naglichi bhakri. So it is the greatest source of calcium. And one fruit which have to be, I should mention, that is sitafal or custard apple. If you are eating custard apple, you can find out the when you are eating it, you can find out some grainy textures in on your tongue. So mind that is a calcium present in the sitafal. Functions: formations of bones and teeth, coagulation of blood. See, such a wide range of functions what we can call for calcium. Then comes contractions of muscles, cardiac actions, milk productions, then the cell membranes in keeping intact, metabolisms and hormone synthesis, enzyme synthesis, transformation of light, that whatever the impulse comes from for the retina, that impulse get transferred into neurological, means the electrical impulse, because of the presence of this calcium in retina. And then comes very important is, the cell division. So it plays a role over there also. So these are the great amount of functions calcium is playing in our body. So when we are talking about deficiency, now again there is no clear cut deficiency. We cannot segregate vitamin D deficiency and calcium deficiency. In fact, they are together. So this is a part of learning. So there is no clear cut disease can be mentioned, but indirect association is there. So you'll find when there is a low content of calcium, the means vitamin D is less, and when vitamin D is less amount of calcium will get absorbed, and less amount of calcium will get absorbed, it lead to rickets and osteomalacia. So again, very difficult to find out whether really calcium deficiency lead to this condition or the vitamin D deficiency lead to these kind of conditions. So this is all about calcium, what we are talking about. Now we are coming to the next very important, phosphorus. Again, one of the very important element present in bones and teeth, and plays a very vital role in metabolisms. And it is present in various kinds of foodstuffs, vegetables, and then requirement, phosphorus requirement have not been specifically considered by Food and Agricultural Organization and World Health Organization expert committee. So here we have done with the phosphorus. Now we are coming to the sodium. Sodium is found in all body fluids. If suppose you'll find someone is, means in the urine, in tears, you'll find the salt, presence of salt is there. So all body fluids contain this iodine. So human body contains 100 grams of sodium ion. Sodium occurs in the food, and it is also added to the foodstuff. Um, so every day we are putting sodium chloride, that is common salt, in our diet, is one of the very essential aspect. When we are talking about deficiency state, so usually you'll find deficiency is seen in dehydration conditions. So someone is having diarrhea, loose motions, where he's dehydrated. Along with the water, the sodium chloride is lost, and the skeletal muscle cramps are very common. So this is about the sodium. The requirement of sodium is 5 gram as per the dietary goal, or what we call it as, or prudent diet, what we call it as, give suggested, recommended by WHO expert committee, that is 5 gram per person for an adult. But as we are living in a weather where there is a loss of uh, salt is much, so naturally we are taking thrice of this amount of sodium in our diet, near about 15 grams for adult. Okay, so now we are coming to the next one, that is a iron. So now we are coming with the iron, that is one of the very important aspect of iron. Adult human body contains 3 to 4 grams of iron, and now here you'll find there is a fine balance of iron which is circulating and stored. So 60 to 70% it is present in the blood. It is in the form of hemoglobin. Heme, that is iron, and globin is a protein. So you'll find 60 to 70% is in a circulating, and the remaining amount in a stored amount. So liver and other organs stored the iron. So mind you, whenever there is any depletion, you will find this stored iron is taken out, and then you will find to body try to acclimatize the condition. The function of iron: formation of hemoglobin, brain development and function, regulation of the body temperature, muscle activities. Then the beside from hemoglobin synthesis, iron, it is also one of the very important component of myoglobin, and various other aspects they have talked about, like catalase and enzymes. Okay, but very vital function what iron is doing, iron is having a kind of a affinity towards oxygen, and that is why it forms a bond, and it is a carrier of oxygen, a life-giving force. Okay, so this is all about the functions. Now from where we are going to get this iron? So two important sources one has to learn: heme iron and non-heme iron. Heme iron we get from animal food, and non-heme iron we get it from vegetable food. So when we are saying heme iron, animal food, so various sources are there, but mind you, this heme iron, it get absorbed easily in the human body, but non-heme iron is not getting absorbed easily in the body. Means animal iron get easily absorbed in the body, while vegetable iron is not getting easily absorbed in the body, in a simple language. So why is this so? Heme iron, it is present in animal food, and non-heme iron is present in animal or plant food. So in plant, what is the problem? There is a presence of some anti-nutritional factors. like oxalic acid, phytic acid, and carbonates. So they form as a salts, and mind you, they interferes the absorption or the assimilation of iron in human body. If suppose it is present, iron is present in good amount in leafy vegetables, but when I'm eating it, so mind you, these anti-nutritional factors will interfere and will, very less amount of iron will get absorbed. So that is what called as bioavailability. Bioavailability. So mind you, this availability is less. So when we are discussing about this, um, when we are talking about this bioavailability, this how to reduce these anti-nutritional factors. Very simple technique is there. When you will be giving this knowledge to your patient, you put 2 drops of ascorbic acid. Ascorbic acid means what? Lemon. 2 drops of lemon. It is an Indian tradition. In a dish, we are putting a slice of lemon. And mind you, why it is there? There is a science behind. And we have to put this 2 drops of lemon juice into your green leafy vegetables, dissolve it thoroughly, and mind you, that anti-nutritional factors will get neutralized and the whole amount of iron we are getting. So the sources: non-heme iron, vegetable origin, cereal, green leafy vegetables, legumes, nuts, oil seeds, jaggery that is good, and dried fruits. So chickpea is the best source of iron. Okay, then we are having another sources, animal sources, as I told you already. But apart from that, the beetroot and your dates, these are the resins, these are the prime sources of iron. Everyone knows how jaggery gets its iron. Uh, Basically, it doesn't contain much iron, but as the jaggery is prepared in iron vessels, it derives iron from there. So deficiency states. So we can say there are 3 important aspects. First stage characterized by decreased storage of iron without any other detectable abnormality. So it is the initial phase, or we can say an incipient phase. Then comes intermediate phase, that is a latent iron deficiency. The stores are exhausted. As I said, there is a fine equilibrium between the circulating and stored iron. So now here the circulating iron is getting less. So naturally all stored and ions are pulled into circulating as an iron. And mind you, that is the intermediate phase. Yet person has not developed this condition. And most of the people in India, they are in this stage condition. Okay, so this is the intermediate or latent iron deficiency condition. And then comes the third stage is that of over iron deficiency. Now here person is having a decrease in concentration of circulating hemoglobin due to impaired hemoglobin synthesis. So the end result of iron deficiency is nutritional anemia. So iron depletion lead to anemia, that is called as nutritional anemia, one of the biggest burning issue, especially in children and especially in the females in the reproductive age group, most vulnerable to develop these conditions. As I said, reproductive age, every month menses reduces the iron content, and mind you, the appropriate proportionate amount of iron is not consumed, and that is why very slowly the females are dragged into anemia. So this is very common condition in our country. So this is a requirement of iron. Okay, so I will not go through the slide. Um, Now we are coming with next one is iodine. Now, very important iodine when we are talking about. So it is an essential nutrient. So again, one has to depend upon this iodine source. The adult human body contains 50 milligram of iodine in the blood level. And mind you, the function is very important. That is synthesis of thyroid hormones. Everyone knows that is thyroxine, that is T4, and triiodothyronine, that is T3. So mind you, if iodine depletion is there, then it leads to this disturbance or in these 2 hormones, that is T3 and T4. So mind you, the people who are residing on a Himalayan belt, which is starting from Himachal Pradesh to all those 7 sister states, Tripura and all those Assam. Over here, you'll find the higher altitude as increases, as the altitude increases, the amount of iodine reduces. And that is why they are getting less sum of iodine. and they develop this condition what is called as IDD, that is iodine deficiency disorder. So it is a syndrome. It contains multiple aspects are there. So what are the multiple aspects? Like you'll find there is a muscular weakness, there is a neurological involvement, there is a eye affections like means what is called as a nystagmus, and then you'll find mental retardation, goiter, cretinism, and so on. So deficiency of iodine lead to this kind of conditions. And the last mineral what I want to talk about is fluorine. Fluorine is called as two-edged sword, means the depletion also lead to conditions and the excess also lead to toxicity. So when we are saying depletion, it leads to caries of teeth, very simple. But when we are talking about excess, it leads to condition what is called as fluorosis. So you'll find this condition is very much prevalent in the southern part of our country, like Andhra Pradesh, and especially some districts like Nalgonda. So you'll find these conditions. Here you'll find the amount of fluorine in soil, in water is so much. People consume it for prolonged period and they develop what is called as fluorosis. So it is of three types, what is called as a dental fluorosis, then skeletal fluorosis, and what is called as um, genu valgum. So these are the three conditions, very important. So drinking water and your food, especially seafood, is a good source of this fluorine. So the requirement is zero point 0.5 to zero point 0.8 milligram per liter. It should be taken. It is accepted limit. But mind you, if suppose the fluorine content is less than this in water, then it leads to caries. And the fluorine content, if it is more than 1 up to 10, then it leads to fluorosis. So dear friends, here today we learned about what is nutrition. It is a science of food and application of that food to our day-to-day life and health. The nutrients, these are the dietary factors. Dietetics, that is a science, means application of a knowledge of a application of the knowledge of a nutrition to the our health. Then we learned changing concept of nutrition, how we have learned the macronutrient first, then micronutrients, and then we try to learn their role and their deficiencies. And then now the international collaboration and coordination is improving, like WHO, UNICEF, and other international organizations, FAO, they are playing a vital role. And now the science of nutrition has moved from small laboratory to the big populations, and mind you, that is called as nutritional epidemiology. And today's focus of attention was micronutrients, and here we have discussed about vitamins and minerals. Vitamins, as we said, fat soluble, and what we said, water soluble. And then we talked about minerals. So this was all about. Now if you are having any kind of doubts, you can ask. Thank you. Hello. Sir on the phone. Hello.
Yes, sir.
Yes, if you're having doubts, you can put it over here right now. Dinde sir. Hello. Are you there with me,
Yes, sir.
students? So please, if you're having doubts, you can ask questions to me. You make your this unmute, and then you can ask questions one by one.